and look at the opportunity 2021 brings. We need to plan and reshape the way we support health and wellbeing in the workplace. The public health team have put together this workshop to provide you with the most up-to-date coronavirus information relating to workplaces, and they'll also offer general information about health and wellbeing in the workplace and what support is available for your businesses locally.
Totally trying to sneak in.
You're on mute, Joe.
So did anyone hear any of what I've already said previously?
Yes. I think
Janetta, can you tell me whether I need to start from the beginning?
I heard you up until the last sentence, I think.
Okay, so I'll start introducing the speakers again. So we've got Laura Wood, who's a health improvement specialist working on workplace wellbeing. Nick Wilmot, who's an environmental health coordinator working on the COVID-19 response. And Katie Cumming, who's a consultant in public health. So Nick and Katie are going to start by giving an overview of reopening your business and being COVID safe. And then Laura's going to talk through workplace wellbeing and supporting your staff during this time. If you've got any questions throughout the event, please put them in the chat bar, and we can pick them up at the end in the Q&A session. I'm just going to give you a brief overview and start today's session by telling you a little bit about the Business and IP Centre, or BIPC for short. So in 2006, the British Library in London started a service to help businesses to innovate and grow, and this was hugely successful. And in 2012, with the support of local authorities and the Intellectual Property Office, a national network of BIPCs in large city libraries began to spread across the UK. In 2019, Brighton and Hove Libraries put in a bid, and we were invited to join this national network as a pilot centre. We're still a pilot centre, meaning we're currently building up our services and beginning to work with partners. So where is the BIPC? We have a fantastic newly refurbished space on the top floor of Jubilee Library in Brighton, and it consists of a networking area, which you can see there in the picture, with PCs and meeting pods, and also a flexible conference area for workshops, which is also available to hire. We've also begun working in partnership with West Sussex Libraries last year, and they're developing a spoke in BIPC in Crawley Library, and they've begun to offer some BIPC services. So what does a BIPC offer? We have business and intellectual property information in the form of books, online databases, and a small team of BIPC specialist library staff can help you access the collections. The BIPC staff and new business partners have started to deliver free practical workshops and one-to-one advice sessions. In the future, we'll be offering facilitated networking events so you can link up with other businesses. And what's great is that the BIPC is in a library. It's free, it's trusted, and it's a portal to other local and national services. We really want everyone, including those from marginalised or disadvantaged communities, to use the service. So we've got 10 superb databases as part of this collection, and they are worth over £50,000. But these are available to you for free with your library card. So some of these can be accessed at home, whilst others need to be used in the library. These databases are research tools that will help you understand your market, competitors, and customer trends, and ultimately make better business decisions. So there's Cobra, which is a complete online business reference advisor. You can use this to explore business sectors, find business support, and ensure you trade legally. It's great for anyone starting a business, as there are over 500 business opportunity profiles covering businesses from pet grooming to snail farming, sign writing to crystal healing. Then there's Grant Finder, which you can search to get funding specific to your business. There's Newsbank, which is a global newspaper database. Then we've got a bunch of company research databases. So there's Fame and Compass. You can use these to search for new sales leads and find out how competitors or companies in your supply chain are performing. And there's also Local Data Online. This resource helps you to understand what's happening in the UK retail sector, right down to a particular town, street, or shopping centre. And finally, there's market research and industry databases, IBISWorld, Mintel, Euromonitor and EMIS. These can help you understand what consumers want in the UK and globally and why. They also show how different markets are performing and include future trends and forecasts. So not to forget the IP part of the BIPC, I want to touch on intellectual property. Intellectual property is vital to the business process. Knowing how to protect your idea, whether it's an invention or a brand name, can save you a lot of time and money. Library staff and IP professionals will soon be offering one-to-one IP information sessions and workshops on patents, trademarks, designs and copyright, and how understanding these better can benefit businesses. Since January, we've been offering one-to-one business information clinics, a chance for you to meet up for us for a free advice session to talk through your ideas in confidence, helping you to develop your business ideas and business plan using these BIPC resources. We're beginning to set up more events and workshops and webinars like this, and in the future we'll be facilitating network events. So why would you go to the BIPC for help? As I mentioned earlier, the BIPC national network is having a superb impact on businesses in the UK. An economic impact evaluation of the network found that between January 2016 and December 2018, the network had supported 12,228 businesses. It also found that businesses which started with the support of the BIPC demonstrated stronger survival rates. After 3 years, normally only 6 out of 10 businesses are still trading, compared with a staggering 9 out of 10 businesses who sought help from the BIPC. We'd be delighted to meet you and tell you more about how the BIPC can help your business and how you can use these resources to make better business decisions. Thank you so much for listening to that short piece about the BIPC. I'm going to hand over to Nick and Katie for today's workshop.
Laura, yeah.
Okay, thanks very much, Joe. My name's Katie Cumming, and as Joe said in the introduction, I'm a consultant in public health. So I may have I have met a few of you in the audience, but others I haven't met before, but I may have worked with some of your organisations. If not before, then over the last 12 months, because I would say if there's one thing that really feels like it's been such an advantage of having gone through the really difficult time that we've all been through in the last sort of 12, 14 months, it's been the fact that here in the city, we've ended up working with all sorts of different organisations and partners to try and make sure that our sort of city-based response is as good as it could be. So this graph here just shows literally the last 3 months worth of our local data compared to the southeast and compared to national COVID rates. So the light blue line is the England rates for COVID, the orange is rates of COVID per 100,000 in the southeast, and the sort of dark blue line is Brighton and Hove. And you can see that the 6th of Feb, where this graph is sort of the point at which it's cut off, the rates in Brighton and Hove were about 150 cases per 100,000 population. And actually that had already come down quite dramatically from maybe the second week of January, when our rates locally were 700 to 800 per 100,000. And now, to put that in context in terms of the reduction further, right now, sort of early May, we've got rates that are down in the sort of low teens per 100,000. So that's thankfully a very dramatic reduction. And obviously our COVID story, or coronavirus as it was known at that point, story in Brighton and Hove started back in February last year, when we really hit the headlines earlier than any other city nationally, because we had 5 of the first 8 cases in the UK were here in the city. And I think that, you know, that did mean that we had to be pretty quick off the mark in terms of our local response, at a point at which Public Health England and the national government didn't necessarily have all the sort of standard protocols and guidelines in place in terms of what we should do in response to a few cases, what we should do in terms of reducing risk further in families, schools. I mean, a few of those local cases were in healthcare settings. You might well remember that we had a couple of GPs and someone who worked in a hospital amongst those early cases. So we had lots of action in the city, which was really made us the sort of front runner nationally in terms of our local response. things have moved on so much, of course, since then, and we've been through a couple of significant waves of infections, both nationally and, of course, locally. Vaccination, which I'm going to focus a few of the slides on in the next 10 minutes or so, has been a real success story in the UK and is a big part of the reason why we've got to the situation where our rates right now, as you see on this graph, are as low as they are. But it's also because of what we've all done in terms of the sort of response to lockdowns. Brighton and Hove, every time we've had a sort of full or maybe a sort of partial or lighter lockdown as we did back in November, the city's always ended up having kind of quite a strong response in terms of all that we've done and the way that our case rates have come down accordingly. And right now, the combination of the vaccination programme, which is now vaccinating people right down to the age range of 40 plus, combined with this latest lockdown and the very sort of slow unlocking through the step 1 and 2, and we're about to come to step 3, you know, we have managed here in the city to keep our rates relatively low, which is excellent news. Laura, would you mind just moving on to the next slide for me? Oh, I think actually that's Nick. Sorry, Nick.
That's my bit, isn't it? Yeah. That's fine. That's fine. Yeah. So I'm Nick Wilmot. I liaise with environmental health, and my main purpose from public health side is to give support to local businesses on what control measures they should be employing to make both their employees and the wider public safe. So where we are at the moment, this is as at now. So this was step 2, introduced on the 12th of April. Things that people are aware of, the fact that non-essential retail shops can open, the personal care premises, you know, people can get their haircut and etc. The indoor leisure facilities, gyms and things like that being open, and outdoor attractions, self-contained accommodations, the Airbnb type places. As Katie discussed already, within the city, the main risk to both residents and employees is the hospitality industry. When the national lockdowns were introduced, this obviously closed hospitality venues. That had an impact on the infection rates. Obviously, taking a long time to come down because there's a lot of infection within the community. But that's improved it. And now the trick is to open up the economy, but in such a way that we don't continue to have issues going forward. That obviously in combination with the vaccination. So at the moment, yes, pubs outdoors can be open. We've had issues with the outdoor structures. So obviously there's rules applying to outdoor structures, and businesses needed support on what they understood and what was allowed to be outdoors. Obviously somewhere where you can get the airflow through, so the risk to people is less. And obviously the wider contact rules with regards to indoor mixing in a social context in people's homes. Can you do the next slide then, please, Laura? Thank you. So with this is as the Prime Minister said on Monday, it's been confirmed. So from the 17th of May, it will be step 3. Within that, as I said already, the main risk to the city is the indoor hospitality. They will be allowed to be opened indoors. It will be the rule of 6 indoors or 2 households. People can meet up outside with limited groups of 30, and hospitality, it must be seated. It must be table service. There's no issues. Sorry, it's my phone. No issues with regards to curfews or the fact that, as before, in one of the lockdowns, people had to serve substantial meals. Those control measures aren't in place, but people will have to be obviously seated, and each venue would have to do their risk assessment on what the control measures will be for internal spaces. Can you do the next slide, please, Laura? So then next step will be step 4, the 21st of June, when we hope, depending on the vaccination levels, infection rates at that time, that the remaining businesses will be open. The main risk that those in the city would be nightclubs, because obviously the dynamic movement of people around, and the larger events, the outdoor events, you know, whether they will go ahead or not. Some of those, the organisers, as people will be aware with regards to Pride, you know, some organisers are concerned about what will be happening and when this step will be happening, will it happen, and what control measures they would need to put in place. So some are looking to go ahead, but obviously with contingencies about what control measures could be in place, and some are deciding not to go ahead. So yeah, that's from the 21st of January. Hopefully it all seems on track at the moment. As Katie said, you know, infection rates are low, and hopefully, you know, they continue to go lower. Each step that we've had so far, there has been a slight increase, you know, when schools opened and when pubs were allowed to open with outdoor seating. There was a slight increase, but then it dropped back down again, which is what was accepted to happen. And it may be that it's going to happen again on the 21st or the 17th. Question with regards to the competent person. Competent person with regards to a risk assessment would be someone who understands the risks of what it entails and the control measures that need to be implemented. You don't need any formal qualification. You just need to understand what the operation is and how to control it. There are various links to the Health and Safety Executive website. That's the best place to look for all the guidance about what definitions are on there. They've got templates with regards to risk assessment and further advice. I think that our email addresses will be given out, and I'm happy to take any individual advice with regards to businesses, so we can give advice. That's the essence of what my team do. So I have a team of COVID information officers that on this next slide that go out and give advice on all these issues. So ventilation, so this would obviously be making sure that you've got fresh air moving through any building. So I did the elections last Thursday, where the poll station was. We had to keep the windows, doors open to make sure we got a flow of air through. It's that sort of thing. And if it's not external, then make sure that the mechanical ventilation is working to get a sufficient air moving through. The social distancing part of that is obviously with regard to keeping it 2 meters, or if not 2 meters, 1 meter plus. Other mitigations, which would be wearing masks when moving around, or having people sitting back to back, or whatever else there's that could be introduced. Screens, maybe another thing with regards to social distancing. Face coverings, obviously to be worn inside when moving around. As I say, dynamic movement. So when people could come into contact and could come into close contacts, as in, you know, closer than 2 meters or 1 meter. And again, it depended upon what the activities were and the risk assessment that people would do. NHS track and trace. So for certain businesses, then you should have the QR code. Those businesses would be those ones where yeah, there is a risk of being close together. So it's hospitality, they should have it, and close contacts, hairdressers, things like that. And the NHS test and trace. So when people use QR codes or alternative means checking into a venue, the NHS test and trace team will be notified if there's any cases, and then they will notify those businesses. They won't say names, they will notify with what there has been a case, the date, the time, and then it will be up to the business to look at their risk assessment on what they should be doing. In the initial phase, if there's one case, it will be just warning and inform to make sure that the control measures in place. And then there's a sliding scale with regards to how many cases there are linked to any one business within a 24-hour period. Next slide, please. So within Brighton Hove, these are the things that we're doing to support businesses. We have linked up with the Health and Safety Executive, so they will be contacting local businesses, giving telephone advice and a certain amount of actual visits on risk assessment, control measures, all those sort of things. I have a team of 4 COVID support officers. We are looking at themes or areas. Up till now, it's been those hospitality venues with outdoor seating. We will switch from the 17th of May to give advice on indoor, those businesses which will be opening up, and typically restaurants that may not have been open already. And we give out advice. So we have an email database of all the businesses which are registered for food within the city, and we send out regular updates to all those businesses. There's over 2,000 businesses within the city, and we do put stuff on the council website with regards to that. So we can give advice. We will help people with regards to risk assessment and what should be in there. We work with the police, so we have a weekly GIM meeting, joint intelligence meeting, which I've got directly after this, where we talk about common problems within the city, hotspots, areas where we have issues, and obviously good liaison between us and the police. The other service is the COVID Marshal. They do street enforcement, but it's more helping and nudging members of the public with regards to ensuring safe distances or wearing masks or giving advice on things that people should be doing. And lastly, we link into the licensing team with regards to hospitality and other venues where we're giving out advice. So they carry out visits during performances, we would say. So when the pubs and clubs are open and restaurants, as they will be, and feeding back to us on any areas where we need to give a bit more advice or any areas we've got concern. I think that's my last slide, isn't it, Laura? Thanks.
Hi. Yes, so this is this slide sort of summarises the situation with regards to testing, and I think that either linking from these slides or maybe on some web links that will be sent around afterwards, there are links to the sort of national guidelines and also some of our local information on Brighton Hove City Council in terms of access to local testing. I was going to say, actually, when I talked about the graph on the slide earlier, if you haven't come across the Brighton Hove City Council website and its sources of COVID information, then it's worth having a look at that. I'm just getting a message from Alison saying there's a lot of feedback.
Katie, sorry to interrupt. It's Joe. Sorry to interrupt. Your sound's gone slightly muffly. There's a little bit of feedback. I'm not sure why. Do you want to say something again, see if it's improved? Apologies for interrupting.
Is that clearer?
No, I don't know. Nick, are you able to do Katie's slides for a little bit? Sorry to put you on the spot. If not,
I'm not sure.
As well.
I could try and do this.
And then Nick can carry on for a moment, or Laura can carry on, and I'll come back into the Zoom call and see if it's any better.
Do you think you can, Laura?
Katie.
Yeah, can you hear me okay? Yeah.
Yeah, we can hear you.
Yeah. So just with the testing, there's different ways that people can get tested in locally and nationally, and there is obviously free testing for anyone that wants to get tested, and the advice is to do that twice a week. So all the information, as Katie was saying, which sadly you couldn't hear, was all the links are on this slide here, and the slides will be sent to you so you can get all of this information out to you. There are lots of resources on the Public Health England Resource Centre which are free to download if you want to put some posters and signs up if it's to help with sharing information with staff or customers around if your staff are testing regularly to allow people to feel comfortable. And this is 3 ways which you can get tested. So you can pick up a test pack from any of these places. And again, if you follow the links, you'll find a local site near you, but generally any of the pharmacies, you can just go in and ask for a test pack, or you can book online for them to be sent to your house, or you can book an assisted symptom-free test at a site near you as well. So all the information is on there regarding to testing. Katie, did I see you come back in?
I'm back here. Is that any clearer?
That's better. Just in time for vaccinations.
All right. So I'm just going to, the next few slides will be about vaccination, such an important area at the moment. So this first slide just summarises the groups who are eligible for vaccination at the moment, which you may well be up to date with, but it really does at times change every few days. In terms of age, that's been the main way that people have been prioritised in terms of the order of vaccination. It's been from the older age groups down, and those who are particularly high risk in terms of being in a health or social care setting, those who are clinically extremely vulnerable, so who shielded during the first and second wave, those who've got other health conditions that mean that they're considered vulnerable or at moderate risk, and they tend to be the same groups who normally get a flu vaccine, those who have a learning disability, and as I've mentioned before, those who are working in health and social care, as well as those who are living in care homes. Also includes unpaid carers. So that's the most up-to-date list. And I think that within the next week or so, probably those who are in the sort of 30 plus age group will start to be called or notified that they'll soon be able to book their vaccinations. So in terms of why it's important because we are all at risk of COVID. I mean, absolutely, I think most of us probably will have had friends, family who have either caught COVID, been unwell with it. Many of us will have had friends or family in hospital with it. We'll certainly have had friends or family who've been staying at home, shielding, and many who've been really worried about getting seriously ill, even if they've been lucky enough not to catch the infection. Vaccines are absolutely going to be the best way to protect us all in the long term, both from catching COVID, from getting seriously ill, emerging evidence, well, not emerging, getting stronger all the time in terms of the research on this and the evaluation. They really do prevent people both being admitted to hospital and certainly dying from COVID. Great news in the last few weeks that you being vaccinated does help prevent your family and those close to you from catching COVID. It protects those that you live with. And also really importantly, in terms of this conversation as well, it's not just preventing the NHS from getting overwhelmed. And we've seen those awful pictures and heard the stories from India and also from other European countries over the course of the last year. But it also supports all of us and life getting back to normal, including, of course, our business, the local economy and the city. Again, in terms of why it's important and why we should all consider doing it and certainly find out the information about how you get vaccinated if you haven't already, is that once it is your turn, getting a vaccine is easy and it's free, and also really important in terms of people who feel a bit hesitant. It's also your choice. I mean, it's not compulsory in this country. In some countries, vaccines have been compulsory for different diseases, but COVID vaccination is voluntary, but it's something that we wouldn't want anyone in the city who wanted it not to get the information about how to get vaccinated. The strain or variant that caused the latest wave in the UK, so over January and February, is so infectious. And we know that others which are around globally at the moment, including those that have circulated in South Africa and Brazil over recent months, and those that are affecting India at the moment, are equally infectious and have caused a lot of people to get seriously ill and also a lot of deaths. So really important that we consider vaccination. You move on one slide, Laura. Thank you. So in terms of just a few practicalities that you might be able to pass on to your colleagues and or those who access services or groups that you work with. Important to be registered with a GP in terms of being notified of your ability to get a vaccination, but you also don't need to be already registered with a GP. That won't stop you getting a vaccination, and people can temporarily register or go to a number of places across the city and get a vaccination without having that registration. If you are registered, then the NHS will let you know when it's your turn by a letter or a phone call or an email, and it'll be possible to book an appointment, which is convenient to you. So in the city, we've been having, well, the Royal Sussex County Hospital has been vaccinating people since December, when it started with healthcare workers and patients over 80. We've had 3 local vaccination centres run by GPs since January, one at the racecourse, one at County Oak Clinic and one at Portslade Health Centre in the west of the city. We've had the Mass Vaccination Centre also open since the end of January. We've got a service for people who are housebound. So for those who can't get out of the house, often for health reasons, there is a service that can come to you. And there's also a mobile vaccination service. So there's a bus or an ambulance that can move around the city to different locations. And the aim of that is really to get to people who might find it otherwise harder to access vaccinations for all sorts of different reasons. Again, the press has been full of all the information about the various different vaccines. So I've summarised a few of the key points here, but happy to answer queries in the questions and answers at the end. The main ones available in the UK at the moment are Pfizer-BioNTech, Oxford AstraZeneca, and more recently Moderna. And all three have been given in Brighton and Hove. Moderna recently and quite small numbers, but the other two have been, residents have been vaccinated with for a while now. They're all approved by the MHRA here in the UK, and there are very strict standards in terms of how well the vaccine works and its safety. And as we all know from watching or listening to the news, that is a process of continual sort of evolution. Many millions of people have been vaccinated now in the UK, and the safety data is evolving, not just from the original trials, which were carried out here and in other countries around the world, but real-time data as more and more people across the world have been vaccinated. Currently here in the UK, people receive 2 doses 12 weeks apart. And as I've said already, they've got benefits in terms of disease prevention, but also very high, they're very effective in terms of preventing people being admitted to hospital and passing on the infection. At the moment, here in the UK, you have to be 16 plus to get a vaccine. In the US, they started vaccinating teenagers in the last week or so. It's okay to be vaccinated if you're breastfeeding. It is now recommended that you're vaccinated if you're pregnant, provided you're in the age group that are eligible for vaccination. But they are, for those who are under 40, recommending alternative vaccines to the AstraZeneca vaccine, if possible. So that's the most recent development. That's been in the last sort of week or 10 days that's come about. It is a moving picture, but I think for anyone who's out there who's not sure because of their own individual situation, talk to your GP, and or certainly when you go along to the vaccine programme, the vaccine centre, there will always be somebody to ask if you've got queries. Laura. So. The next slide, Laura. Thank you. So just a quick overview of on the day for people who haven't been vaccinated yet. Really important just to follow the instructions, the information that's posted to you or sent to you electronically. If you are feeling really unwell on the day, particularly with a temperature or a high temperature, it's worth delaying the vaccine, but for a cold, a minor cold, certainly go along and get vaccinated. Wear a mask, follow all the social distancing rules at the vaccination centre, and there'll be lots of sort of prompts and stickers and markers on the ground and people directing you to go in the right direction. Anyone who goes along gets asked a few questions about their medical history, particularly history of allergies, and you'll receive the vaccine normally as an injection in the upper arm, the one that you don't use for writing, etc. A couple of the vaccines you have to wait for 15 minutes or so afterwards in case there are any immediate reactions. And the system varies a bit depending on where you get your vaccination. For some of them, including the Brighton Centre, you book for both vaccines at the same time, dose 1 and dose 2. And for a couple of the other centres, including I think Port Slade Health Centre at the moment, you'll be given the date for your second dose following the first dose, but not at the same time. And anyone who goes for a vaccine is given a leaflet with very detailed information on the vaccine itself and all the side effects, from minor to slightly more major. Just again, important to remember, and also in terms of getting out and about and more back to normal over these next weeks and months, still important to socially distance, wear a mask and wash hands having had a vaccine. And the full protection from that vaccine will only be there 2 to 3 weeks after you've received it. Laura, I think there might be one more. No, that's it. Thank you.
Thank you. So that was a bit of context in terms of COVID safety, which we can share with our staff and colleagues and friends that we are around. And it's just going over really the importance of prioritising health and well-being in our workplace. And as we can see from this quote, health is created and lived by people within the settings of their everyday life, and work being part of that. And I think we've all kind of seen that come alive even more so with the COVID situation. We also know that working people spend an average of 1/3 of their time, their waking hours in work, and work being the second biggest cause of unhappiness. So it's really important for us to prioritise and focus on our staff wellbeing programmes. So if you haven't already done so or not aware of, there is this report which was written by the Director of Public Health in Brighton and Hove in 2019. And when you get sent the slides, you can click on this image and it will take you directly to that report. And it's got loads of great top tips and resources, information in there about workplace health that you can practically put in place. But generally the report is about making health your business and how a healthy workforce is the bedrock of a productive and thriving economy, which right now, as we're thinking about reopening or maybe changing the way we're working, for everyone it's going to be different in terms of going through that roadmap. It's really important for us to have healthy, happy staff as we go back into reopening or rejigging how we're working. So in terms of good work and healthy work, what does that mean? Being in work is a starting point, and that has a real big impact positively towards our health. But also this list on the left-hand side just shows some of those things that can really help provide a good environment to be working in. And some of these we can kind of pick out and reflect on our current situations we've been in the last year and a half, in terms of income being the basic need for us, in terms of having a purpose and identity that work can provide, and learning, which is one of our 5 ways to well-being, being able to learn and develop, but importantly around supervision and being supported throughout this time and having that sort of management that is supportive in all of our situations where affecting our work in some way. Flexible working hours has been an interesting one, and for many it's been really positive change to their working environment. For many it's been more of a challenge, and for many it's been impossible and it's not been appropriate for that sort of industry or work setting. So it's really interesting how we can kind of see all of these things come to life in the situation we've been in the past year. So I think it's gone past one somehow. Hang on. Oh, it's missed a slide somehow, but it's kind of reflecting on what healthier staff means. That's having better morale for your staff. If you're providing a workplace wellbeing program in your workplace, then you're more likely to have less time off from staff because they're more likely to be in work healthy, less likely to want to leave overall, and will perform better productivity, better output, and also better health outcomes overall. In terms of being an employer, what benefits are there for you? For every £1 spent on workplace health initiatives, the feedback is generally £4 back. I've read something recently the other day actually that has increased to £5, but I didn't have an updated infographic to show that. And also for those that invest time in promoting wellbeing in their workplace, their workers are 8 times more likely to be engaged in their work. We also know for those people that engage in those workplace initiatives, they tend to be more fit, healthy, and less stressed, better job satisfaction, and less likely to be off ill, which all will be of the benefit to employers and employees. So I kind of invite you all to kind of have a stop, change, start approach and think about what workplace wellbeing offer you might have. And if you don't, to start thinking about what putting one in place and how you can start thinking about supporting your staff in terms of health and well-being. I put up this stat just to show that from the last sort of lockdown and reopening in June 2020, a study was done and it showed that 62% of people who didn't feel adequately consulted felt anxious about returning to work, compared to 42% who were adequately consulted. So it's really important to keep that communication going, especially as things are changing for everybody, whether you're remote working and looking at going back into work, whether you're continuing to remote work, whether you've been working solidly throughout this whole time, whether people have been furloughed, or whether businesses are now reopening and have been shut or open and shut during this period. So it's really important to communicate, consult and engage with staff, particularly with returning to work, and what support might be appropriate or best for those people coming back into work, and how we can do that in a supportive way. So these are just a couple of things that we know is going to be an impact and a result of COVID-19 in terms of staff feeling stressed and anxious. We know that before the pandemic, 2 in 5 people were reporting mental health symptoms relating to work. And now we know that more than 60% of adults felt that their mental health got worse during lockdown. So we know each person is going to be impacted differently depending on their industry, their job, their household circumstance. It's really important to have an individualistic approach to this and have supportive management Wellness action plans are a great way, and we've got lots of templates. So if you do want any of those, do get in touch and I can send some to you as a way to engage in that conversation, to be supportive. There's also some free training here on psychological first aid. So do have a look at that if you haven't or not aware of that, as something that's really useful tool to look at. Isolation is something we've all been impacted by in some way, and in particularly in a work context, being disconnected from our colleagues might have been made it harder to work for some people. They might have been furloughed, some people might have been continuing to work. So it's about kind of bringing that together and thinking about team building activities as well, and team agreements, which again we've got templates for if you would like to look at those, to kind of really build back the team and connect them so that they feel safe in coming back, and it might reduce some of those anxieties. Musculoskeletal health would have been impacted during this time. Again, for many it won't have at all if it hasn't changed their working context, but for some they may have been working from home and remotely for long periods of time. Physical health is really important and can help with some of that musculoskeletal health concerns. And it's really important for us to think about ways of promoting these health sort of messages around how people can sort of self-care and support themselves, but also as a work setting, what can we do that really sets up a workplace that enables people to be physically active, for example. So this is just some messaging which we can think about as we're opening our doors, or thinking about how people are continuing to work during this time, and thinking about how we can have healthy messages around how are they getting to work and a healthy commute. So there's lots of active travel infographics, lots of free resources and videos on cycling to work safely. And there's the new Better Points campaign. If you're not aware of it, it's a free app for workers or in Brighton and Hove, or people who live in Brighton and Hove. If you're actively travelling or sustainably travelling, then you get points and they turn into rewards and discounts and vouchers for shops, etc. across the city. So something really worth sharing with staff that can really impact and get them more physically active, which will ultimately support their health and well-being. Burnout is something we've all, I'm sure, experienced or heard of at this time, and these are just top tip ways in which we can support our staff to reduce and prevent burnout. Particularly one being breaks, making sure people are having regular lunch breaks, making sure people are taking their annual leave that they're entitled to really recharge and kind of recoup throughout this process. And there is lots of information here on the Wellbeing Zone around lots of top information and resources that you can refer people to. Healthy meetings is another way to reduce burnout, and just thinking about how we're working, and that might be for the future and ongoing, and it might be interim of just being aware of how people's capacity, maybe people are having back-to-back meetings, maybe people have been on their feet all day, thinking about what's the best way to communicate. Is it by phone call? Is it by meeting? Can they be shorter? And should they have breaks in between? There's a guidance and a checklist that we have on this. So again, if you're interested in resources, I'm just whistle stopping through these bits, but there's plenty more information which I can share with you, which you can get in contact with me about. So just to finish off in terms of the support available that's free for Brighton and Hove businesses, there is some workplace health champion training coming up. The booking link is there. You do need to be able to attend all of those dates to complete the course, but you'll be a workplace health champion for your workplace, or if you've got colleagues that would be interested, do send it on. You'll be invited to 6 network meetings a year, and there's that opportunity to have one-to-one support with myself if you would like to as well. So that's one way you can kind of access support through our team. There's also a list here, which I won't go into detail, but if people do want information, do get in touch, and there is the web link there with lots more information on. I just want to touch on the health needs assessment, and it's really important to think about what your staff want. When we're thinking about all these messages we might put out, or whether people are facing burnout, it's understanding, do your team think that, or do your staff have that? Because they might not, they might have different needs to everybody else. So it's really having a survey or some sort of data to analyse what are the needs of your staff to make sure your workplace wellbeing programme is fit for purpose, and putting an action plan together to do that. And we can help with that. We can certainly help provide you with the surveys and the support afterwards. Do sign up to the newsletter. I won't go into detail about that, but there's 6 a year and lots of information up to date on workplace health, wellbeing and COVID support at the moment. So the web link, the QR code's there, and the email address if you want to sign up, do that. Loads of resources here for you to take away and look at. I'll just point out this one, which is a really useful guide around looking after yourself and others around mental health during the COVID-19 situation. So I really would refer sharing that with colleagues, friends, family, and have a look at all these useful resources and links. And I've just pulled out a few here. Again, if you click on them when you receive the slides, they'll take you directly to these toolkits, which are really useful to show how you can support mental health in your workplace, how you can support sleep and recovery, for example. Really worth having a look at the website and downloading lots of those free resources there. And I won't go through these, they're more for you to take away, but it's just around sharing this with your staff, around supporting you, having a little checklist they can check in with themselves, thinking about their self-care needs, and also thinking about customers you might be working with. As we've said, everyone's impacted in some way by the pandemic, and it's about understanding that you might be working with some vulnerable customers that you might need a bit of help and guidance in referring them to services, or just kind of top tips around conversations that you might be having. So it's kind of for us just to say, follow the roadmap and the guidelines that were set out by Nick at the start, share information around the testing and vaccinations Katie went over, gain support from leadership if you're not leadership yourselves, and implement a workplace wellbeing action plan to address your staff needs. The contact details are there for support if you would like any support on anything we've spoken about today. And there's directly my Laura Wood, my email address, and Nick's regarding any of those things. So there's a bit of a quick whistle stop, but if you've got any questions, now's the time to ask them.
Hi everyone, I really enjoyed that. Thank you so much, Laura, Nick and Katie. That was really useful. We do have a comment here from Lisa Myton says, I got a letter inviting me to book my vaccine, but the national website at the time, I guess, wasn't offering anything locally. But good news was she found a telephone number on the council's website, called it straight away, and they booked her in. So that's good. And Casper's asking.
I think that's great. Can I just say, Joe, second to that, I think the general advice at the moment, because a few people have said that, particularly when a new announcement is made, you know, like everyone over this age can book their vaccination. And sometimes the system is so busy that it can be quite difficult to get an appointment locally, but they will be available. So the advice is you could always just wait and try again, and you should be able to get a vaccination closer to home. But it's great to hear that that worked well anyway in that situation. But don't give up, just go back and try again.
Thank you, Katie. And from Casper, Casper's asking, hi Laura, could you post me the reference of the research that stated staff are 8 times more likely to engage in work after using a programme? Is that in the slides?
It's in the slide set. So there was a link on that particular slide, so you can access it. I think it was British Heart Foundation that did the research, and they've got loads of infographics like that, which are quite useful. And I can send you the recent one because there was up-to-date information around that. The money spent, which Deloitte had done around how much investment you get back in investing in your staff wellbeing. So I can make sure that link gets sent as well.
Okay.
Liz is asking, really good presentations. What's the level of take-up of vaccinations in the UK and also in Brighton Hove? Do you know that roughly, approximately, level of take-up?
So what I would say is that it is changing constantly, and so the good news is that for some of the age groups who started being vaccinated first, although in Brighton Hove we were a little bit behind other areas and certainly behind East and West Sussex, we are catching up. So in those older age groups, sort of, you know, upper 80% are being vaccinated. We know that for some of the younger age groups, the uptake is really quick, which is great. So that now once people hear that they are eligible, a lot of people are getting vaccinated quite quickly. But we know, as I'm sure you've heard sort of on the news and on various different programs, discussions around it, that various different factors do influence somebody's likelihood of getting vaccinated or getting vaccinated quickly. Ethnicity has made a difference to some, you know, some different ethnic groups have been a bit slower to take up vaccination, but very much are doing so now. And some groups who've got specific medical conditions, disabilities, it's taken a bit longer. So I think, you know, we're doing well, but we've still got a little way to go before everyone's adequately protected. the only thing we can do as a city to support that will mean that we'll all be safer in the end.
Another question, is aircon in workplaces COVID safe? And is it as good as fresh air or open windows? That's one for Nick, possibly.
No. There's been lots of research about that and lots of cases. It's not. You need fresh air to get in rather than recycling what you've got, because it just would go round and round. So no, it would need to be fresh air or mechanical ventilation. Yeah, from external.
Thank you. I've got a question for Laura. I was interested about your Workplace Health Champion Award. I'm just wondering, is that free, and how would one go about finding out about, signing up to that?
Yeah, absolutely. It's completely free training. The accreditation, which you can choose to do alongside it, it's not compulsory, is £20 to get the accreditation alongside it, but it's completely free. The link's on the slide, so you just book yourself on. You just need to sign up to the booking procedure, create an account to do that. But once you're booked on, that's it. It's via Zoom, just while it's online, until we used to be face-to-face, but for now it's online. And if you can't make those dates, or if colleagues or friends you're talking to can't make those dates, do get in touch and let me know if you're interested in finding out other dates, because there will be more put on. I just don't have the dates yet to share with you. But yeah, it's a really great training, and the network feedback so far, particularly during this time, the last one we had was in I think end of March, and loads of people of the champions came away saying how inspired they felt just by talking to other sort of champions across the city and seeing and hearing the challenges that other businesses are facing, but also what they called them quick wins. They're not my words, what quick wins worked for them and their staff. And every industry will be different, and they're all from different sort of types of settings, but they just find it valuable just having that network there available. So if you are interested, or you've got any questions about it, or what the involvement is, it's not, you don't need to have huge amounts of time to be a champion. It's kind of just being that link with us here and getting training and support if you're interested in workplace health and wellbeing.
Thank you. I have got another question, unless anyone else has got one. I don't want to hog, but I was interested in testing you a bit again, Laura. The 5 ways to wellbeing, not to go off topic too much, but what are the 5 ways to wellbeing?
I feel like I'm in an exam, but it's fine. So the 5 ways to wellbeing are ways that we can kind of look after ourselves. It's a bit of a self-care sort of message. So that's around connecting. So that might be connecting, if you're in a workplace context, connecting with colleagues. It could be outside of work, connecting with friends and family. So whether that's phone calls, face-to-face, it can be in any way. You've then got learning, so continual learning, skill development, again, really relatable to work in terms of CPD, but again, outside of work, you might like to read or keep up to date with, different news or any new topics you're interested in. Active, so, and the 3rd way is to keep active. So recommended guidelines are 150 minutes a week if we can do that, but the main message is just get out and move more, particularly now where we may find ourselves sitting much longer. It is worth noting it's Mental Health Awareness Week, and the theme is nature this week. So if we are thinking about getting outside, it's quite a nice way to promote moving more at the moment and getting outside if the weather's nice. And the 4th one is take notice. So taking notice of our surroundings, taking notice of ourselves and how we're looking after ourselves, taking notice of others, being kind. And the 5th one is give. So that can be giving time to ourselves, to others, volunteering. So these are the 5 ways. And again, I can put the link in what goes out. You can find information on the NHS website around the 5 ways to wellbeing, and they're just great ways we can follow to look after our mental well-being.
Yeah, good to kind of everyone. Well, I'm going to try and make a mental note of remembering those 5 because they're all really good points. So thank you. So on that note, I can't see any other questions. So I just wanted to thank
Jo. Sorry, Jo. I just saw one question which I'm not sure whether it was answered. It's from Caspar. Hi there, Laura. Could you post me the reference of the research that stated staff 8 times more engage in work after using a program? If you can send the link, then I'll add it to our follow-up email.
Yeah, it's all on the slides though.
Yeah, thank you. So thanks everyone really for your time this afternoon and for joining us at this webinar, and also thank you to Laura, Nick and Katie for their expertise. It was really, really interesting. Janetta will be sending information around either today or tomorrow with slides, And also just wanted to let you know on the 27th of May at 8 o'clock in the morning, we've got another BIPC event. It's all about what sort of legal structure is best for your business, sole trader, partnership or company. So that's 8 a.m. on the 27th of May. We'll be sending a link out for that. So, and also before we go, I would be so grateful if you could just take a little bit of time and fill in this one-page feedback form, because that's really crucial. That enables us to keep offering BIPC services and resources for free. We need that feedback to see who's attended the event and what you thought of the event. So we might be able to pop that in the chat. If not, it will be in the follow-up email. So I am going to say goodbye and wish you a lovely sunny afternoon. I'm going to take a glass of water outside, maybe an ice cream, and go and take some me time now. So thank you so much, everyone. Bye-bye.
Bye.